Good afternoon, everyone, and thank you for joining us for the UK Asian Film Festival, UCAF Mental Health Roundtable discussion. I'm Rakhee Joshi, and I'm chairperson of UCAF's advisory board, and I'm delighted to welcome you all and our extra special guests who will be guiding us on the important topic of mental health awareness, with a spotlight on South Asian artists. First up, a very warm welcome to the extremely talented actor, Mrunal Thakur. Mrunal's film Love Sonia marked her debut on a global platform and earned her critical acclaim. So well done, Mrunal, welcome.
Thank you.
Super excited also to welcome Professor Dinesh Bhugra, CBE, a very beloved friend of the festival and Emeritus Professor of Mental Health and Cultural Diversity at the King's College London. Some of you may know this already. Professor Bhugra authored Mad Tales from Bollywood, the first book to investigate how mental health illness is portrayed in Hindi cinema. Very excited to have you here with us, Professor Bhugra. We're thrilled also to introduce you to Dr. Saman Khan, consultant child and adolescent psychiatrist working in NHS Lanarkshire and local program lead for higher training in child and adolescent psychiatry. Welcome, Dr. Khan. Please also meet Dr. Sadia Mohammed, consultant child and adolescent psychiatrist working in the Specialist Child and Adolescent Mental Health Service in NHS Greater Glasgow and Clyde. Very welcome. Dr. Khan and Dr. Mohammed are co-hosts of Gupshup with Dr. Sadia and Dr. Saman, a YouTube channel reviewing the depiction of mental illness in Pakistani dramas. So something very interesting, very different. We're very excited to have you with us.
Thank you.
Great. Delighted also to welcome Anuj Radia, again, another beloved friend of the festival and one of the leading South Asian journalists in London who covers entertainment, news and reviews. Founder of Filmy Shilmy, superb blog, one of the UK's leading entertainment portals. Excited to have you, Anuj.
Thank you, Rakhee. Thank you so much.
Great. And last but by no means least, we're delighted also to welcome Nileeka Bose, a Bollywood dancer, manager and choreographer. Nileeka is founder and creative director of the Bollywood company and Noble Management and a very keen advocate of mental health support and mental health issues. So very, very warm welcome to you as well, Nileeka. So to kick off, I'd like to hand over to the UCAF founder and festival director, Dr. Pushpinder Chowdhry, MBE, for an introduction to our work in this area and our keynote address.
Thank you, Rakhee, and thank you everybody for joining today. Good afternoon, and welcome to this roundtable discussion on a very important mental health issue. We have all lived with COVID for a year, whether we are aware of it or not. We all have been badly affected by it. Overnight, all our work and social life was moved onto line. We had to quickly adjust to this new way of life, change and have new norms, adjust and make a different way of being. And all this started to take a toll on our mental health. Last year, this time in March, as the government was announcing lockdowns and scientists were working frantically to control the pandemic, we at UCAF were coping with last-minute cancellation of our nationwide 10-day film festival. We had to jump into action with frantic urgency to update all our team, artists, venue partners, collaborators, sponsors, and audience who have actually bought in tickets to to be at our events, see the films. While we were dealing with all the logistics of cancelling flights and informing guests, our festival realized that this cancellation of festival had really badly affected emotionally our festival staff, volunteers, artists, and all the people who work in the film industry who were part of our festival. And we found ourselves spending a lot of time supporting them, working with them, and holding them, because this was important to us, right? Because these people, the volunteers, the staff, and the artists have a long-term ongoing relationship with the festival. And in addition to all this, we had to keep the organization going. We had to keep engaged with our audience, because we had one eye on the following year, because we wanted to not only continue our activities, we wanted to bring back the festival the following year. We found, as all the production houses, performances in theaters and films, film theaters were coming to a halt, it also dried up. The other people who, other artists like the makeup artists, the photographers, costumes and set designers, their flow of work, which came from the creative industry, also dried up. This was a real, dark, surreal, unbelievable situation where nobody had been before. And in addition to this, we were hearing on the television increasing in infection rates, high rise of death rates, that also added to the panic and anxiety. And the other ongoing lockdown challenges were fear and safety, personal safety, the worry about our own health, and that of our loved ones. It was totally overwhelming for everybody, affecting mental health. Contrary to the belief that we are all in it together, we looked around, the virus actually was affecting the people of color more, pointing to proportionately high death rates from Black and Asian communities, as did of people with limited financial resources. So people who could found it even harder to cope with was people on the lower incomes. There were many grants and loan schemes that came about, which was available for businesses and their staffs. Workers were furloughed, but sadly, most of the people working in the actually arts industry had fallen through the safety net of this financial support. And it's these people we were continuously coming in touch with. And these were the people who had contract work, and this contract work was project-based, and they worked independently and relied on the bigger performances to supply them with contract work. So it was the whole chain that got badly affected. And this is where we thought there might be an idea to set up a mental health project, time limited, a year or for 1 year, to act as a research and development to find out what the creative industry need in place to have appropriate and meaningful support. So we started with talking therapy. And we felt that people to talk about where they are and how they were feeling was the most important thing. So we set up a project called Talking Therapy. This was a free phone-in service run by qualified therapists. And we offered 6 free sessions, sessions to whoever called in. Focus was on active listening, connecting with the people and the client to help them to understand how they felt. Because what happened with this lockdown, a lot of latent issues within the clients also flared up. Just to hold them, to gain new perspective, believing in the fact that they are being heard and understood, so they can build up their confidence and self-esteem. The therapy helpline acted as a one-stop support space for emotionally, as I said, holding the clients, fast track them if they needed, or make a referral should they needed longer term therapy. So we were doing a lot of referrals, a lot of holding, and a lot of fast track. Unfortunately, sadly, there was a death of a client during the time we were offering this therapy. So it was a quite intensive piece of work that was undertaken by the festival. And further, apart from the talking therapy we offered, we wanted to create at another level a sense of community for creative lovers, film buffs. So we started a UK Asian Film Wala Club, which operated like a book club. We would watch a film, then come on Zoom discussion and talk about the recommended film. But what we found, often this group ended up focusing on related current issues in the context of films, like women in film, in front of and behind the camera, the Me Too campaign, mental health and lack of support framework for the artists and filmmakers. We find there is a popular belief and almost a myth that people, if they are successful and they are academically bright and they have achieved professionally, can be held as a proof that they cannot be mentally ill. The reality is successful people actually prefer to hide their difficult issues to avoid negative association with stereotypical image and the stigma that is attached to mental health. They find it even more difficult to trust and share their fears and anxieties. So we thought that actually fed into our talking therapy, where we gave confidence to people to connect and can talk anonymously on this talking line. The other good thing we actually got involved with to create a feel-good factor and wellness and to lift spirits and create sense of fun, to organize we organized Bollywood dance workshop to get people dancing. This was done with Bollywood Dance School. And of course, with Nileeka, we organized drive-in cinema events with her Bollywood company. This was an amazing success, and it got people out, and the film buffs were delighted to come and stay in the car, but join in with the social activity that entails watching films with other people. We had a Bollywood quiz on Zoom, Sing Along Antakshari, which actually got people together every Saturday afternoon to sing along. You didn't have to be a good singer. And then with Mrunal, your Priya Shakti was also part of this, a short film that you acted in, and very proud to be part of our event where we screened the film, this short film, and you were part of the discussion and Q&A. So all this to promote wellness within the creative fraternity, to help promote and keep the enthusiasm and feel good factor and wellness promoted within the people we worked with and other people that were associated with it. We also had a week-long social media campaign in November, working with South Asian artists to promote a message of seeking help. And this was, the videos were produced in native language to reach out wider community and encourage men in particular, to seek help. We find that although women come forward relatively easily to share their anxieties, even if it means amongst themselves, men always find it difficult. And there is a shockingly high rate of men committing suicide. So, so for the last 10 months, our activity has been on these events. All these activities was to collect and collate data by using feedback forms, statistics on how many people attended the sessions, stories that they were telling us, testimonials that they're giving us, and blogs they were putting out. And what we now want to do is to collate a comprehensive report from all this data that we have collected, and put forward some real meaningful recommendations to develop a relevant and connected support services framework for people in the creative industry. I feel that there isn't a kind of specialist service, may it be bullying in the workplace or legal advice on the contracts and working conditions. And again, then the being in public eye, what kind of emotional support that they require. Thank you very much for listening to this, and thank you. Back to you, Rakhee.
Thank you so very much, Pushpinder. I think it's incredible what UCAF as an organisation has achieved over the last 12 months or so, particularly in the arena of sort of mental health issues. And as you've said, Pushpinder, we've learned lots as well from having had a year sort of focused on this topic and supporting others as well. So thank you all very much, not just members of this group, of course, but everybody dialed in for sort of helping us on that journey. So without further ado, I know we're all burning to talk about the issue of mental health awareness. And so if I may, I'd like to kick off, please, with Professor Bhugra. And so in particular, in light of the book that you wrote, Mad Tales from Bollywood, and just picking up on a theme that Pushpinder mentioned a second ago about high functioning individuals or people who are either academically brilliant or people who have very successful careers, including people, say, for example, in the arts that might be high profile actors, etc. What issues, pressures, and challenges are faced by South Asian artists more generally? And how do you think the COVID-19 pandemic has sort of impacted those issues? With the, as I said, with a particular focus on sort of your experience of having studied the impact of it sort of within Bollywood as well.
Thanks very much, Rakhee. Thank you for inviting me, and thanks for that introduction earlier. I think there's sort of several things that we need to bear in mind. I mean, firstly, mental health is too important to be left to experts. It's everybody's business, and any of us can develop anything at any given time. And we know fairly clearly that something like 3/4 of psychiatric disorders in adulthood start below the age of 24. Half of them start below the age of 15. So there is a massive need for everybody to be aware of the stressors and what we go through. And one of the sad things has been that quite often when people talk about infectious diseases, they talk about infection control and vaccination and so on and so on. Then people tend to forget the impact on people's mental health and well-being. We know that, we've seen it in previous epidemics and pandemics, particularly SARS-1, Zika, Ebola, Middle Eastern respiratory syndrome, etc., that the focus always is on control of infections. And we forget people who've lost their loved ones, people who've not been able to say goodbye to their loved ones, people who feel lonely, feel isolated, can't sort of talk to people, people who've survived, the survivor guilt that, I survived and others, my friends or family, have sort of died. So all those things seep through the society, and it can affect us in different ways. And we've heard, particularly in Bollywood, sort of actors, producers, directors, others, experiencing and acknowledging their, notwithstanding the COVID question, acknowledging their experience of depression and anxiety and so on and so forth. So I think that's, on the one hand, that each of us is vulnerable to any of those things. But on the other, I think it's also worth remembering that some of those emotions are human responses. And we should not be pathologizing if you're feeling anxious and you're feeling depressed, you're feeling sad, and you're having a bad day. That does not mean that you need antidepressants. What you need is talking to people, doing other things, getting over that hump, as it were. So there is a clear challenge for all of us to make sure that acknowledging that these are normal human responses. And sometimes people will need help. Sometimes they will just need somebody to talk to. Sometimes they will need professional help. So there's a kind of pyramid of interventions that we need to be focusing on. And there have been studies which have shown that 70 to 90% of all illness episodes get treated in personal, folk, or social sectors. So nowadays, with pandemic, with COVID in particular, there's a major challenge that you can't go to the Gurudwara or the temple or the mosque, and you kind of stuck at home. And when you're talking to people, you're talking like that. You can't sort of shake hands, and you can't give somebody a hug, and and endless meetings we have online. And normally, when you have meetings, you can have a cup of coffee together, have sort of sort out the meeting agenda, sort out things get done in a very different way. So it's a very different way of dealing with the normal human responses. So the challenge really is, firstly, acknowledging that we are all prone to it. B, that one size doesn't fit all. Different conditions, different people will need different ways of dealing with. And thirdly, that we need to be very clear that these responses may need different strategies, whether it's, as you were saying, that artists have been under pressure, and Pushpinder was talking earlier about what the film festival has done and what that means. But it also means that each of us has different strategies in coping with stress and with mental stress and physical stress, and so we need to have opportunities of maximizing those strategies, what we do. And it's quite clear that we can't, and we haven't been able to do what we would have done 2 years ago. Go out, meet friends, have a cup of coffee, meet for dinner, go to the cinema, go to the theater. So part of the challenge really is understanding what works for each one of us and how do we find that, and looking for that particular key to unlock that lock.
Really interesting insight, Professor Bhugra. Thank you so very much. And I think one of the key themes that I've drawn from your comments just now is that sort of lack of social interaction, the human touch, if you like, which is so very intrinsic to our being, that we've somehow not been able to sort of draw from that in times when we've most needed it, in times of comfort, but not just that, also in our sort of day-to-day lives and in our professions as well. And I suppose this is a nice segue actually into drawing Mrunal into the discussion as well here, because of course you are an actor in India, and of course you yourself will have experienced this sort of firsthand, if you like, and that I think over the last 12 months or so, I think production houses have slowly been sort of getting back up and running, but of course it's by no means exactly the same. But Mrunal, a question for you actually is, how do you think what has happened over the course of the last year has impacted artists creatively? Do you feel that they're able to sort of perform or function or work in the same way, or do you feel that you've had to sort of adapt? And it'd just be really interesting to hear your thoughts on that.
First of all, thank you for the lovely introduction. And Dr. Dinesh, I'm so thankful to Pushpinder also for you guys, because of you guys, there are thousands and thousands of people there who are sane and who are happy. So thank you for this great initiative. Getting back to your question, well, it has impacted us like really in a massive way. I mean, I have few actor friends who had this multiple crazy times. They had these thoughts of committing suicide because they said that I would not die out of COVID, but I would die out of hunger because the checks were not coming in. And the second thing was, it was difficult to survive, and considering the number of suicide cases, celebrities committing suicide was just kind of setting an example. And they basically, all the people who travel from their hometowns to Mumbai, it is lonely, when, especially at times like COVID, you don't get to interact with family. You don't, how long would you do Zoom calls for? I mean, everybody, like with my school friends, I was having this discussion and I only said that, hey, you know what, it's really silly, but I wish that my teacher taught me how to deal with a situation like this. Or what do I do if there is someone a dear one that I lose? There are a lot of friends of mine who lost their loved ones, their family, but they just couldn't cope up with that. And instead, they just got into anxiety and depression. Some people lost their jobs. My very close friend, cousin committed suicide because of this. But, it's also the society which kind of pulls you down. Also, the kind of feedback that I was getting that, Mrunal, this was supposed to be your year as an actress, where all your films were supposed to be releasing. And because of pandemic, it's all going to be on OTT platforms. It's really sad, but my approach towards it was, it's a blessing in disguise. Let's take it in that way, because in a matter of one click, the film is going to reach in 240 countries. People always, I think this was a time, rather than, we always used to crib that I, as an actor, don't get time to work on myself. So I made sure that, first of all, I took precautions. I worked on something like Priya Shakti, where we would just educate the kids, that, because most of the children in India don't know what the parents do. They don't know what their job is like. So to let the kids know that, your mother, your mom, your dad, or any of your family members, they are on the front line. They are the frontline workers, and they're actually the warriors. So we need to appreciate that. So that was one, and I'm really glad that we did that. Priya is very close to my heart. I've always wanted to voice an animated character, and apparently Priya is India's first animated superhero. So I'm glad. I remember my producers called me in the month of September, checking if I was okay to shoot. And there were many actors. They were very scared that, no, we don't want to take a risk because we might get COVID. But I also had to think about the lightmen, the art team, the spot dadas, who were working on a daily, per day basis. Because, and I remember a couple of the members from my shoot coming to me and just saying thank you for agreeing to do this shoot, because finally I can earn for a living. It was very overwhelming. Producers, obviously there's too much expenses, but I'm really thankful the kind of producers I'm working with, they all took care of us. We make sure that we quarantine 2 weeks before we reach the location. It's in a way a blessing in disguise. We get to spend time with ourselves. In a city like Mumbai, you can barely hear your thoughts. But when I was in Dehradun shooting for Jersey, I could actually spend some more time with myself, and it helped me to know the character in a much better way. And what's the beauty that the production houses, the producers, they all are coming together and making sure that we don't clash our releases, because every film deserves the love. So we're making sure that even when they're announcing the films, no film clash with each other. If you ask me how difficult it was filming, yes, it was difficult. Well, like day one, there are some romantic scenes, and I'm like, you better, I'm telling this to my co-actor, you better don't have COVID. And we would like literally spray each other with a lot of sanitizers, and God knows, I don't know how many sanitizer I have inhaled or I have actually like consumed. But 2 days of holiday is fine. The third day it starts getting onto your nerves. And when you constantly have this industry friends talking about, oh my God, I'm so sorry about this, Mrunal, your career was about to boom, and suddenly there is a full stop because of COVID. Obviously, I felt bad, but patience is the key. Never lose hope. Instead, just work on yourself. And this is what I tell all my fans and all the people who kind of follow me, because you're not going to get this time again. You might as well spend time with your family. So I've discovered new bonds with my family. I never spoke to them. I did not know my banker father, what kind of pressure he goes through. And when I got to know this immense respect for him, and like Dr. Dinesh, he mentioned, like Pushpinder mentioned, that we don't have conversation. Even as an actor, there are so many insecurities that I go through. And it's really nice that when I come back home, I come back to my family and I can discuss my problems, where I'm not the actor Mrunal Thakur, and I'm like just my father's daughter who has genuine issues. And the best thing that my dad told me is like, Mrunal, look, there is no pressure. If you feel like you're not happy with the industry, we are here to take care of you. So never ever think of anything crazy, because you're very precious. So he makes sure that in any kind of conversation, be it with his friends, his daughter, his son, his clients, he'll always appreciate them, value, make sure that they feel good about themselves. And that's what Dad said, that it doesn't cost you dollars to make someone feel happy, right? You can just like, the least thing that you could just say is like a big thank you for, it's like, for example, Pushpinder was this great initiative. I think I was sane because of these film festivals. Like, I, as an artist, it's my job to entertain people and make sure that I must say a big thank you to Pushpinder and to all the guys present here for coming together, sharing your experiences, motivating the world, because that's what we need. We need someone to just push you, motivate you. And thank you for making me a part of this, Rakhee.
Thank you so much, Mrunal, and thank you for being the light in our sort of world as well, because after hearing of your experiences, of course, it's been quite difficult, of course, to hear how it's been for you and sort of your colleagues as well, more generally, and some very sad stories there. But you've given us some very uplifting examples as well at the same time, in that, I think everybody goes through their own personal struggle from time to time, whether you be, say, for example, an actor in the spotlight, or whether, say, for example, you aren't necessarily in the public eye. The mental health issues impact every single one of us in a different way, and it's all about how we sort of channel our energies to help each other.
So just to conclude, Rakhee, I'm sorry, but I want to tell this to the live audience who are watching right now. And I just want to say that, look, everybody, even I have shitty days, okay? Like, I have horrible days. But what's the point if you don't have shitty days? You won't appreciate the happy highs, right? So it's okay. It's okay to be not okay.
Oh, thank you, Mrunal. And that's super reassuring as well for all of us, to hear as well. Thank you for sharing. If I may, I'd like to turn now to Nileeka Bose, who, as we mentioned earlier, has been a super duper mental health advocate and has done some great work in this space as well. And so it would also be interesting to hear from you as well, Nileeka, as to how things have been in terms of sort of creativity, and also what you're hearing as well from the folks that you work with in the industry that you're a part of, and any other sort of thoughts and insights you wanted to share with us today.
So I'm known for being very straight up, very honest, and I don't really wrap things up in cotton wool. I will tell you how bad things are when they are really bad. And for me, I represent an industry that is probably one of the lowest when it comes to the film industry. The dancers are, they come in last. We're told our call sheets and times at the last minute anyway. So where we are, we're the bottom of the ladder, and we know how it feels to be there anyway. To know that rug was taken from under our feet and the work isn't even going to be there. A lot of my team are on universal credit, which is terrible. That's not what they were expecting. And one, to have to deal with that, and two, to have to deal with it so suddenly and overcome, okay, I'm unemployed, like I've worked on a craft that's now currently not needed. That's a huge blow to them. And I'm similar in the way that Pushpinder said, that I've become a support system for so many people, and that wasn't a role I expected to take on as a manager. I was there to sort of just give them the work and pay their invoices, but when it comes to a team that you care so much about, you can't not pick up the phone when they're in need of someone to talk to. And I have been quite open. I suffered with postnatal depression myself, and I have taken medication for depression in the past, so I know what it feels like. There's a fine line between people feeling, on their low days, anxiety and feeling low, and when does this become full-on depression that needs to be treated. So as someone that just wants to support, I can't be their doctor, I can't be their therapist, but what I can do is just listen and hopefully just direct them to the right places. So yeah, it has been awful. And also dealing with that, and then dealing with how I feel as well, because I know that the work that they get usually comes from me. So if they're like, it's going to be all right, isn't it? Have you got bookings now? And the answer is we just don't know. So I can't tell them when we're going to turn that corner. All I can do is remain hopeful and grateful. And like Pushpinder said, do our own projects, which we did, the drive-in cinemas. But that was honestly through just wanting to do something. You know, it wasn't about money. We didn't make any money. We did it for the community. We did it to have something to do. And for me as well, was to give the dancers some work and something to look forward to. So yeah, that's my honest review of what's been going on for us.
Phenomenal, Nileeka. Thank you so very much. And it sounds like it's been really, really difficult, just all round. And certainly I think it's really nice to hear also that, you know, your team members felt that they could come to you and sort of share their concerns. And as we were saying before, there's an interdependency between all of us, not just economically, say, for example, where, you know, you might be helping others get work, and, you know, just as I said, you know, this is our bread and butter, this is our day-to-day, this is what earns our living, this is what puts food on our table and sort of looks after our families. It's not just about the economics of it, there's just so much more to it than that. And Mrunal touched on this before when she was saying that, you know, film production units are sort of are proactively working with each other to make sure that dates don't clash. So there's that mutual respect between all of us. And I think that's what you've touched upon really beautifully, Nileeka, is that we have that sort of mutual recognition and understanding between ourselves, firstly as human beings, rather than being sort of colleagues or, you know, parent and child, etc. It's just about having that sort of common understanding and just taking that time out to sort of breathe and just sort of reflect. So thank you, Nileeka. It's been really lovely to sort of hear from you as well. So as we were saying, I think, look, it's clearly sort of very difficult for, you know, for all of us more generally, and in particular, as we were saying before, about how sort of, you know, I was talking about sort of individuals that are sort of high functioning or those that may be sort of in the public eye. Like, this is clearly something that, you know, people may feel that the emotions or sort of feelings that one has when they don't have good days, they're just heightened. And sort of one arena, and this is where I wanted to bring in sort of Dr. Mohammed and Dr. Khan, is that, you know, I think the portrayal of mental illness in sort of the arts, so whether it be in films or books or theatre or even sort of dramas and serials, can have sort of quite a profound impact on audiences sort of receiving that kind of content, and sort of people who are going through issues themselves. You know, it's actually quite an interesting medium for them to either sort of draw comfort or, you know, learn from sort of things that are being depicted on there, or even for others to get a better understanding of what mental, you know, health or sort of illness is really all about. And so Dr. Khan, Dr. Mohammed, as I mentioned earlier, you guys have a brilliant YouTube channel, and you have your Gupshup program, and for those of you who haven't yet watched it, I would highly recommend. You made some fantastic sort of comments on, in particular, Pakistani dramas, and there were two in particular that you sort of focused on. So it'd be really interesting to hear your perspectives. Both, I know that, you know, you are medical professionals, but at the same time, you know, you've had an appreciation of certainly media content, and specifically with respect to Pakistani media content and dramas, and how sort of its portrayal of mental illness has influenced your sort of thinking as well on the subject.
Thank you very much for your introduction, Rakhee. We're really pleased for having us here and sharing panel with such esteemed participants. We, as everyone was saying, you know, things were very stressful, and we had our first lockdown, and there were lots of concerns about health, you know, kids being homeschooled, and suddenly you had lots of different roles. So I guess every kind of challenge can be turned into an opportunity as well. And I think that's what me and Sadia did. We both love Pakistani dramas. We've been watching it for many years, but we never really had the time and space to think about it. But this was an opportunity for us to think more about it. And a lot of times we used to think about how mental illness is depicted in dramas, and a lot of times we were unhappy with the way it was portrayed, when it was kind of, it had negative connotations. And me and Sadia, we both individually have written to producers to maybe hopefully make an impact. But it just, this idea evolved that why don't we start our own kind of review of kind of mental illness depicted in dramas, because a lot of people might not have the words to describe what they're feeling, but they can see it portrayed in art, and that's probably the best way to engage with the audience. And it's so kind of, you know, it's so popular. Pakistan dramas are seen across in India and Pakistan, all over the globe. So this was like a perfect opportunity to use that as a platform to talk about mental illness. And I think one of the best things of of making people aware of it is by talking about it. And I know lots of artists have done that, and it's that's the thing that we need the most, is people having a dialogue, so people are kind of comfortable in opening up about it. So that's what started it. So we've talked about different mental illnesses, and we've done about 9 episodes so far. Sadia, do you want to say more about that?
Yeah, no, again, thank you very much, Rakhee and everyone at UCAF for inviting us. It's a real pleasure to be here. So yeah, someone's given a fantastic introduction to our work. And I guess I've kind of always had this sort of feeling, I mean, I don't know about the science behind it, but I've always had this feeling that, film or drama is kind of like a really non-threatening medium to explore so many issues for people. Yeah, it's something that you can get really involved in, but also have that space when you're kind of separate from it. And I think being in kind of lockdown, where we've all had so much more time, to, I suppose, be with ourselves, and to think about, hopefully to think about ourselves, sort of, if you can see something on the screen that can resonate with you, with yourself, or with somebody that that you live with and love. I hope we hope that would give them, our program would give them also that bit of support in terms of thinking about that and processing and being able to reflect on these kind of issues. So really, our hope was to kind of discuss popular Pakistani dramas and to show depictions of mental health issues, whether positive or negative, and to really allow some language around that, some labels around that. So I think one of the things that we found, we've kind of consistently found, is that although mental health issues are portrayed, they're not labeled as being such. They're not labeled as this is, depression, or this is anxiety, or this is PTSD. So this is really something that we've been trying to do in our work when we talk about the different characters and the different things that they're presenting with, the different features. We label that, and we identify these as being mental health difficulties. And then we also talk about what can be done, and again, it does involve about specialist treatment, but also what individuals can do for themselves, what their families can do, and also what communities can do to support these people. So we've been getting some fantastic feedback from people, from our viewers, and really, again, just kind of echoing these kind of sentiments that it's helped them to recognise, to be more aware of, and to actually think about what they can do to address these difficulties for themselves and for others. And I remember one episode we had, one of our earlier episodes actually, and there was a character who was a doctor who had made a suicide attempt, and we actually commented on that this, for some people might be quite quite shocking, and why would a doctor do something like this? And we talked about how, it's very well known that doctors have higher rates of suicide. And again, we got a lot of feedback, a lot of comments back from our viewers to say that really they weren't aware of these issues, So it's really been a fantastic piece of work to have done.
Thank you so much, Dr. Mohammed. I think it's lovely that Dr. Khan have been able to find mental health issues sort of through your channel. It's interesting you mentioned that some of the behaviours displayed in the content that you viewed weren't necessarily labelled as such, and there's just an undercurrent, if you like, of just very tricky sort of mental health issues, but without actually verbalizing them as such. I think people can often consume content like that, but not necessarily, unless it's really spelled out as to what's going on, then it may not even manifest itself to, as I said, the audiences, that actually what they're viewing is, a very difficult or sensitive mental health issue. I also kind of wanted to just touch on sort of the responsibility, if you like, of, things like the arts, film, theatre, books, etc., to ensure that it does portray mental health issues in the right way. And what I mean by the right way is really in a constructive way. And actually, so that to the extent that there are problematic representations, and I think Dr. Khan, you touched on this, is that, we are sort of flagging them up and saying, actually, it's not okay to really, show sort of something in a certain light, do you think it's fair to say that that we all sort of collectively have a social responsibility to make sure that the producers, etc., that are making this content for consumption are sort of depicting things in the right way, whatever the right way means in this context?
I think it is really important, and I think anybody now, especially with social media, anybody can respond to that, and I think they do get a lot of feedback, and so it is really, I think it's a social responsibility of the media to portray things so that it's not shown in a negative light, because obviously it will then make it more stigmatizing. So I guess it's all a responsibility to destigmatize mental illness, so that people can talk about it more openly. And I think people have started that. I think the change is already happening. Even in dramas, we've seen over the last few years, there is a positive change happening. Mental illness isn't kind of labeled as a permanent disability. It is something that ebbs and flows. So that definitely there has been a change, but I guess it is all our responsibilities to keep voicing when we see things negatively portrayed.
Brilliant. Thank you so very much, Dr. Khan. It's really interesting to hear your perspective on that point as well. I'm going to steal a few more minutes of Nileeka's time, because I know that we are going to lose her, unfortunately, very shortly. But actually, just touching on sort of media, I'm going to turn my attention now to a question that was submitted as part of our sort of question and answer session a bit later on. But actually, it's a really important topic, and I was hoping to steal your time on it. Social media. Now, we know that it can be a tool for raising sort of awareness on mental health issues more generally, but it can actually also cause negative experiences, such as feelings of stress or isolation, depression, and anxiety. So we were just wondering if you had any tips in particular on helping folks combat social media anxiety, also bearing in mind that oftentimes people are posting things that are great and, when their life's looking wonderful, but actually, what do you do about helping people to cope when things aren't as great and actually they're not posting things, so you don't really know what's going on behind the scenes?
Yeah, I think social media is such a tough one, and I think it doesn't matter the number of followers you have, that it can still affect you. Like, you could be someone with a really small account, but you could be watching things and consuming media that really, makes you feel a certain way every single day. So it's about limiting the use. It's about, using it in the right way, and also to pick up those warning signs of when it's not becoming a tool. Like, we have so many tools just that we can use to help us or hinder us, and social media is just one of them. It doesn't have to become a part of your daily routine. I think I got into a habit during the first lockdown of waking up and checking my social media first thing, and I noticed that the kind of negative impact it was having on my mood. And you can start to build those habits and not realize. So I do think that social media is something that we need to really, as humans, understand what we can use it for and the positive and negative effects that it can have on us, for sure. And it's not been great for me. I definitely feel that I've had my ups and downs with it. I've got quite a small account, but even with that size of account, the kind of things that I've interacted with people, they've not always been great. Sometimes they've been wonderful. So it's a real mixed bag.
Thank you so much, Nileeka. And I'm really sorry to hear that you've experienced that personally as well, because that's another thing. Social media responses can be very hard to filter, and even if you were sort of to choose not to really even read them, just to know that they're there can be sort of really hurtful, and it's just not a nice thing to have to experience. But thank you so much for sharing that with us, though. We very much appreciate it. I see that Anuj is back on. Hi, Anuj. We were just about to get into hearing a bit more about Filmy Shilmy and sort of your perspective as well on the very important topic of sort of mental health issues and awareness, certainly through your work both with Filmy Shilmy and sort of interviewing actors, but also any sort of other experiences that you wanted to perhaps share with the group.
Yeah, I think what my objective is as a journalist, and what I've kind of decided from the onset, is to kind of speak to actors, not just regarding their work, but trying to gauge and engage more with them about their lives and trying to understand the human side, even if it is, trying to understand the insecurities, the deepest fears, because I think that it's important to realize that behind the persona that we see, there is a personality that's there. So I think for me, I think it's always very important to kind of do that. Now, actually what happened with me, especially in lockdown, I was actually getting therapy for CBT because I suffer from health anxiety. And I also have anxiety to the general anxiety I also have as well on a daily basis. And CBT was a very positive step for me, even though lockdown happened. But for me, CBT gave me this sense of it gave me a sense of liberation. It gave me a sense of confidence that I actually did something to at least address the issue that I had. Because for quite some time, you know, I and my friends will also vouch for this. My mom and dad will definitely sort of vouch for this, that there would be times when I would panic at the drop of a hat. You know, if I would see, I don't know, like a spot somewhere, or if I had a certain symptom in my body, I would immediately Google symptoms and react to the worst things ever. So I think in a way what happened was is after that I got CBT and I had my first session of therapy. I think what happened was is because of lockdown and because the fact that there was literally everything was closed, I felt like especially because of a few friends who kind of suggested me that you should get your name out there and people should see the work that you do. Thankfully Zoom was there. Thankfully technology played a huge part, I think, in encouraging more independent work from home. And that's how Film Me Show Me, sort of the YouTube channel, started gaining prominence. You know, it's all God's grace and of course the support of all the loved ones and all the well wishes as well. But it really helped. It kept me sane, you know, when I say this, because Rakhee, I don't know how I would be if I did not have the profession that I'm in. If I was not a journalist, if I was not sitting here perhaps one day interviewing John Abraham or interviewing Mrunal Thakur, I don't know how I would be, because it's what I love the most. So it's definitely, I think like therapy and I think encouragement from people, especially loved ones, really helps, especially when you are going through this phase. Because I feel like Bollywood in particular, if I just wanted to kind of make a note of this, like we've seen films like Bhool Bhulaiya, for example, right? Great film, we all loved it. But why is an illness like split personality disorder always portrayed in a very sinister way? I've never understood this. You know, it's an illness. It's obviously something which people go through, but when they have representations like Manjulika, people automatically, it adds more to the stigma of the conditioning. And I think that's something which I've always been very bothered by. But thankfully we have films like Dear Zindagi, which is also like taking us in the right direction. But yeah, I think, sorry, that was a bit of a tangent, but I just kind of wanted to highlight that point and just sort of say that. But yes, I think Film Me Show Me has definitely been blessed to have lots of well wishes and you know, lots of amazing people supporting it and lots of great friends in the industry who are supporting it too. So cannot complain.
Oh, well, congratulations, Anuj. I think Film Me Show Me is absolutely fantastic. Thank you also for sharing your sort of personal experiences as well. And you know, it's really hard, and we will come on to this in a little while in sort of a separate segment, but I think support and support structures more generally are so critical. And, you know, Professor Bhugra, I know we've had separate discussions as well with a part of the UCAF group on sort of, you know, support structures when we were speaking in the context of 15 Park Avenue, for example. And we'll move on to that in a second, but actually I did want to introduce Aanika Bhalla as well, who's very patiently been waiting here, and I wanted to give her a very super special introduction, in fact, because she is a very key sort of contributor today as well to our session. Aanika, for those of you who don't already know her, is a mathematics teacher based in London, and Aanika has also done some fantastic work in the arena of mental health. She is the mental health lead at a school. She's also volunteered for the Mind charity crisis nightline, so a very difficult job there as well, and a mental health first aider. And Aanika's generally done sort of lots of great work to raise mental health awareness within the South Asian community. And so Aanika was very generously going to share her sort of personal experiences on the topic of mental health with us here as a group today. So very warm welcome to you, Aanika. Thank you for joining.
Thank you. Firstly, I'd like to say thank you to Dr. Pushpinder Chowdhry and her entire team for inviting me to speak about a topic which is very dear to my heart and to be a part of this. As you know, my name is Aanika, and like mentioned, I am a secondary school maths teacher. I've been doing that for just over 10 years. Throughout the years, I've had many interesting conversations with myself about my mental state and my mental health. I've gone through phases where I was sort of diagnosed with borderline personality disorder, and I'm continually, I'm diagnosed with depression and anxiety. And I may just show some of those signs now, I'm very anxious about this entire event. So from my early teens to my late 30s, I'm in my 40s now, the views and the conclusions have changed drastically. At all phases of my life, dealing with my issues was extremely challenging. The time that I found the toughest to cope with was when I started teaching. Not only did I have to worry about my own issues, but I had to make sure that I wasn't affecting my work, especially the children that I was working with. So I only had to take responsibility of myself, but I had to take responsibility for the children. The pressure was immense and it was extremely different to what I was used to. So the general therapy, general counselling for myself was all very self-centered, but this was a different issue when I got into teaching. I've always had some form of therapy to help me understand my issues and get by, but this wasn't proving to be helpful when it came to my work-related stresses and strains. The counselling, although helpful, wasn't really addressing the root cause and resulted in me leaving the profession within a few years. Then due to various reasons, financial circumstances, I then went back into teaching. And then again, another time came and I found myself resigning again and then back into teaching. So this happened a further 2 more times. I kept leaving the profession and coming back. It wasn't until I took part in what the school had introduced was an employee assistance program, which is quite a new thing that just happened within the last 5 years or so. And it's provided by the Education Support Partnership. And that made my life, it just completely changed my life. This is a program that allows you to access a wide range of services to help with the health and the well-being of staff in the education sector in specific. For me specifically, speaking to someone who was not only qualified in mental health counselling, but also understood the day-to-day life of a teacher was really comforting and refreshing. The empathy, the understanding enabled me to identify the root cause of my low phases and understand the combination of the work and the personal life triggers combined. I continue to receive this counselling, so it's something, even if I'm having a good time or a good phase in life, I still make sure that I do get my counselling in mental. And over the last few years, it's managed to help me gear my life in a direction which works for me. It's improved my career path. It works for me, and it's working for my employees as well. So, I mean, I wouldn't have probably never have gone for the mental health lead team. I would never have done some of the, I run the mental health groups for the students as well, because we do know that, educating the students from a younger age and secondary school especially is important. So something like this I probably wouldn't have done had I not gone through that counselling process, and most likely probably would have carried on the cycle of resigning, going back again, resigning and coming back again. So this counselling has enabled me to feel more motivated, and it makes me happy almost every day. Having such work-related services, in my opinion, and from my experience working on the crisis line for the mental health charity Mind, I believe is invaluable, and it is crucial to both the employees and the employers. And coincidentally, I have said something that Dr. Bhugra had said earlier on, that mental health is everyone's business. So I think it's really, really important that every industry, every sector accommodates for the mental health issues of their employees. So thank you.
We're so proud of you, Aanika, if I can add that. Immense respect.
Thank you.
Yeah, absolutely. Thank you, Mrunal. Thank you, Aanika. Yeah, like mental health is absolutely everyone's business. And thank you so very much for sharing your story with us today. It's certainly been very inspirational and uplifting as well. And you've had a difficult journey in that, if I may say so, the formal sort of support structures that you encountered sort of through the course of your career, whilst they seemed like they may have been helpful, actually, it sounds like when something was a little bit more tailored, and certainly counselling that really understood the stresses of your profession, and coupled together with that any sort of personal experiences as well that needed to be taken into account to offer you the support that you needed, it was critical, I think, in this scenario. But I think we can certainly, I think everyone here can draw from your personal experience, and actually it's a really nice way for us to just explore the concept of support structure that I briefly mentioned earlier and how critical that is. And I also sort of briefly mentioned as to how we'd had a separate discussion with Professor Bhugra on support structures, both formal and informal. And I think actually it might be nice to bring Mrunal and Professor Bhugra into this discussion and just ask you both, where you think the gaps are in our current support structures, both in the UK and in India as well, and in particular to sort of support South Asian artists' mental health issues. So if either one of you would like to contribute, that would be great to hear from you.
I think the question is really important one as to when we are feeling stressed or distressed, who do we go to? And, what do we see? I mean, I think the first and foremost, I mean, there's a question in the Q&A box from Vish about, how do you help somebody who doesn't want to be helped, who feel that there's nothing wrong with them? So I think one of the key challenges is to try and find what the anthropologists have called explanatory models. What do I think is wrong with me? Is it really kind of, in the cultural context, is it a problem? Or am I just kind of, going back to, again, the threshold of what's normal and what's abnormal, and at what point abnormal becomes a diagnosis? And the point that Anuj was making in terms of sort of cognitive behavior therapy, and, how does it CBT work for whom, and what are the sort of steps? So there are informal support systems, and then there are formal ones. The informal ones are family, relatives, friends, which have been, as Mrunal was saying, there has been a kind of shift in the lockdown and beyond, and Pushpinder also mentioned it earlier. So one of the big challenges is, how do we keep that going? You can't just sort of, true friends will stick with you no matter what. And, you will, any time of day or night, you can ring them up and say, hey, I need help. And, they will step in and help you. So those kind of informal, and then there are challenges, as we've heard, that people may go to religious places, and particularly going to the Gurudwara and listening to pravachans, or going to the temples and listening to bhajans and participating in, which is not always possible in the lockdown days, but that is again an informal system. So one of the challenges for us as professionals is that we have to work with the community. We need to work where people go. And the fact that, Asian Film Festival has done things to improve people's mental health. It's not a mental health organization. It's not Mind, it's not Sane, it's not a mental health foundation. But the fact that you guys have identified and offered something, providing safe space to a number of people, I think that's absolutely admirable. And also, so once you've done that kind of informal, quite often people are struggling. They don't know where to go to get the right information. And, we heard about social media and, all the sort of rumors and nonsense that goes on. Sometimes it's very difficult to sift out what's true, what's correct, and, fake news. So knowing where to go. So organizations like, Mind and, Film Festival and Mental Health Foundation, so you can go their website and check what's going on. And then there's the kind of semi-formal systems through voluntary organizations, then formal systems through your general practitioners, through health visitors, through nurses, through specialists, whether they're general psychiatrists or child psychiatrists, or, so there are different levels. And again, I think I want to sort of go back to the question, which is that quite often we as a community are so frightened of seeking help because there's a sense of shame, whether you're a doctor or, you're an actor or you're a politician, that if the word leaks out, people will not talk to me, nobody will come to my house, as if you have got some kind of infectious disease. It isn't. And I think again, the challenge really is, how do I look after my own mental health? How do I look after the mental health of people around me, people I love, people I care for, my friends, my family, and then out into the community. And then it is that sort of, going through, because vast majority of mental health symptoms may not be identified as such. And again, there's a very cultural way that if you're feeling stressed, you might think, oh, my heart is sinking, so I'd rather go to the cardiologist than go and see a psychiatrist. So it is something that, it's all our responsibility to educate everyone that, there's nothing wrong. It's part of human nature to feel stressed and distressed and feel anxious and feel depressed and feel angry. But that does not make it, that it's, for life. It may be, it may not be, but you can have diabetes and you can have hypertension. So, you can learn to live with those. So how do we make sure that people who seek help then are provided help in a culturally sensitive, in a supportive, non-punitive way?
Yeah, so the issues and pressures and challenges that I, as an actor, have faced. My first biggest issue was the social media, because if you support someone, you get backlash. If you don't support anyone, you get backlash. So I don't know what am I supposed to do, whether I'm supposed to make a statement on any political issue that is happening around. So I think as a celebrity, as a public figure, I'm always at the target. And people would send me such nasty DMs, like really awful DMs. So there was a point where I had to just like tell myself that this is what my life is. I am going to get judged. People are going to say things, and all I need to do is just graciously ignore. That's one. Second is, as an actor, my job is to act, but I did not realize that suddenly it has become an influencer's world where what matters are the numbers on the social media. And the majority of the brands and the teams and the work or whatever deals that the clients reached out to me, they were like, I'm sorry, Mrunal, even though you're a great performer, we cannot give you this project because you don't have the reach, you don't have the followers. And I'm certainly not the kind of actor who would just randomly go and buy followers. I believe in organic because I want my social media to be as organic as it can be, and I want it to be handled by me. It needs to be real. I don't want to post something on social networking sites where I always pretend to be happy, where I'm actually not. So it's actually a pseudo life that I'm living. So it was a conscious decision that it's okay that if I'm missing out on brands, but I'm going to portray myself on social media as the kind of person, I'm like a regular person. So in the lockdown period, I made sure that I went live on my social networking sites, asked the people what their problems are, what their struggles were. And it was really interesting to have them on the live chat, just like random fans, and talking about it. And few of them mentioned that they really look up to me. It kind of gave me so much courage and strength. And trust me, I have really amazing friends, including Anuj. There were times where I ended up calling him and just like crying over the fact that I don't know where my career is. I was really scared about it. But patience it is. You need to wait. In this generation, especially, you guys need to understand if it is not going to work out, you need to keep trying. It took me 8 years to make a Bollywood debut, where since it's the background that I come from, the television background, there's a stigma that a television actor cannot be a Bollywood face. So that kind of society kind of tried pulling me down, but I made sure that I give my best. I used to go for audition, give the audition, although I knew that the very next moment the guy who was taking my audition would just delete it. I knew that's going to happen, but I kept trying. And finally today here I am talking to you guys. The third thing I wanted to talk about was, see, as a personality, as a public figure, it's my responsibility to talk to my audience, share what problems I go through, which encourages them to share their problems as well. It's not just you who's going through problems. Sometimes when I discuss my problems with the strangers, I love taking local like public transport, and I like talking to strangers. So when I end up discussing my problems, and when the stranger discusses his problems, I look at it as, oh my God, my problem is so petite in front of him. So imagine few people are dealing with cancer and whatnot. So I feel as a public figure, it will be really nice if other actors and actresses share their problems. It will just encourage people to just like open up, because there's always this hesitation that should I talk about my problem? Should I not talk about this? So the moment they are, you know, the moment you give them that comfort zone, they open up and they discuss their problems, and that's when the conversation happens. A conversation is not going to happen unless and until you don't address your problems. All you need to do is just address your problems. And the fourth and the last thing that I want to tell you all, that one thing that I never did was, I the smallest thing. It can, what are the smallest things can give you that can give you joy? It can be as small as lighting a candle next to your bedside, next by your bedside, and just taking shower, listening to your favorite music, or just eating your favorite food, or cooking for someone. Which you need to find out things that gives you joy. When was the last time you looked at yourself in the mirror and said that, hey, Mrunal, you're capable of doing great things. And you know what? I'm so proud of you. You're doing great so far. So I want all the listeners to just go in the bathroom, just open up, take your name, and just say, you are the best. It gives you different confidence. If you will not have faith in yourself, no one else would. So just make sure that you keep telling yourself that I can do it, I can do it. Just like the film Three Idiots, all is well, all is well. I do that quite often, because whenever I walk into a room filled with actors and directors, of course, people, I do feel pressurized. Inside, I am really scared. I'm nervous because I don't know how to behave or how to respond sometimes, and I'm really scared about this group discussions. I can have great conversation when it comes to one-on-one, but this is how you learn. This is how you face your problems, and just share it with you. You need to find comfort, people who love you and who are not going to judge you, so that you can open up with them. And the last thing is, you need to eliminate the people who you feel are toxic, because there are people who always start a conversation, but no, I don't think I can. Instead, you need to try. You can help your friends by making sure that they're on a positive track. They eliminate the words like but, if, मुझसे तो नहीं होगा, I can't do it, मेरे नसीब में नहीं है, you know. So these are the small changes that you can do. Let's start with your family, then friends, and yeah, this is it.
Fantastic. Thank you so much, Mrunal. We've all learned so much from sort of your contributions just now. And I've sort of, from a personal perspective, will definitely sort of start implementing some of those things already. And yeah, it's been phenomenal to hear sort of from you on that specific point. I think I also wanted to draw on just the sort of almost commoditization, if you like, of the celebrity, and how sort of social media has gone some way to kind of, as I said, commoditize the celebrity. So, your worth, as you said, is sort of how many followers you have and how much income are you going to generate for a particular brand. So that kind of stuff is just, it is toxic, it's hard. And like you said, it's about kind of just refocusing on ourselves and bringing sort of any sort of positive energy that we can to sort of each of our lives. And again, to Professor Bhugra's point on sort of drawing upon sort of the support networks, both formal and informal, in order for us all to sort of just feel stronger, both sort of individually and as a collective as well. So thank you both so very much for your remarks on that. And if I may, I'd like to draw upon Anuj now as well, to sort of contribute his thoughts too. Thank you.
Yeah, so first of all, very beautiful explanations we had from Dr. Bhugra and Mrunal here. And, I just wanted to just sort of talk a bit about the entertainment industry at the moment as well, because if we think about it, it's a very strange time, if I can say, because on one hand, it's fantastic. We have public figures like the who have come out and have been very open about their mental health issues. And I think it's fantastic that she started a foundation which obviously encourages people to kind of seek help and get treatment. We obviously have our very own Mrunal as well today, who has obviously been very open about her experiences. But at the same time, though, I think there's also this very toxic nature, especially on social media, you know, because I feel like, especially of recent, like I remember when British presenter Caroline Flack had sadly passed away last year because she had taken her own life. You know, everyone was going on this whole thing about be kind to one another, you know, be nice and just be there. It's okay not to be okay. But then suddenly what happened is that people forget that very easily. And then if they see something that they don't agree with, they immediately start becoming very aggressive and start becoming very toxic. So I think just not in social media, I think even in the industry as a whole as well, I feel like there's this very unsaid competition that goes by, especially with the profession that I'm in. You know, it's like you have to fight to be relevant sometimes because no one's telling you. लेकिन क्या होता है जब आप किसी की work देखते हो, जब आपको लगता है कि हाँ मुझे भी ये करना चाहिए, like you just kind of have this very intrinsic sort of mentality where you have to fight to be relevant. And sadly what happens is the gatekeepers or the people who help you with your work or who provide you with opportunities, sometimes they get a bit power crazed as well. And I think it's very important to emphasize that, you know, everyone is struggling. You know, my struggle might be different towards what other struggle is, what someone else's struggle is. And I think the sad part, especially in this entertainment industry, is that whilst conversations are happening, people have lost that compassion to an extent as well. I feel like people need to be a bit more compassionate, to be a bit more understanding, and need to be more welcoming, because especially with, like I said, this industry, it can get very, very toxic. And I've noticed it from very close eyes, and I can sort of talk from personal experience. And I just think that it's important that someone needs to try and at least be that change, you know, in terms of being more compassionate and being more kind. So I think I just wanted to add that on as well. I think that's something which definitely needs to be improved as well within the industry.
Thank you so much, Anuj. I completely agree. I think compassion is so, so important. And as you said, we just need to rid ourselves of this sort of toxicity. And certainly, as you've mentioned, the entertainment industry seems to sort of suffer quite a lot at the hands of toxicity more generally, because for some reason, people seem to think it's okay to sort of troll celebrities or just write unkind things about them. You know, as I said, with the thought that, you know, they're not human, you know, they can take it, or, you know, they're in the public eye, so they kind of almost should expect this kind of thing, or an added layer of sort of critique, or just, you know, just, you know, face or be okay with others being unkind to them, which I think is really unfair. But, you know, like you said, I think we all just need to be, you know, more compassionate sort of, you know, of each other and of each other's difficulties. So thank you so much for highlighting that. If I may now, I know that we're sort of, we've had some really super interesting discussions so far, and thank you also very much for all of your contributions. I'd be remiss if I didn't now turn to our sort of Q&A segment now of the session, and we've had lots and lots and lots of questions that have just been pouring in, and of course we had quite a few submitted before the session as well. I know folks on the line will be really keen to hear your thoughts on some of these. I'm going to just dive right in, and I'm going to ask about some quite tricky issues. A question for psychiatrists. So how can we change the perceptions of the elder South Asian communities when talking to them about mental health to remove stigma? Because of course, particularly in the South Asian community, there is, you know, this stigma, or, you know, sharam. It's that kind of, it's the shame of sort of living with either, you know, mental health issue yourself, or having a loved one, a family member, a friend who's suffering from issues. And how, and the question that's come in is that, you know, it seems to be the perceptions of perhaps, you know, elder members of the South Asian community that may sort of be more sort of strongly identifying with a sort of more negative connotation, or the shame, as we talked about, of mental illness. So how, just coming back to the question, how can we change those perceptions?
I think, I mean, again, one of the big challenges really is that, you know, everybody knows somebody who's had mental illness of one kind or another. It's just a question of acknowledging it publicly. And one of the interesting things that, you know, we did a piece of work a few years ago, because South Asians would present with depression in very different ways, because Punjabi has no word for depression. And you can't translate it into Hindi either. But, you know, again, over the last 40 years that I've been in psychiatry, things have changed, things have shifted. So one of the big challenges particularly is that, you know, I mean, nobody talks about the portrayal of what we would call depression in the Ramayana. You know, there's a kind of family history among Suryavanshis. Dashrath develops depression when Ram is sent off to, you know, kind of along with the Lakshman and Sita, they're kind of, you know, exiled to the forest. And that's very clear. If you look at those symptoms, that's what we would sort of call, you know, the clinical depression. So one of the ways is using those kind of examples and say, well, if, you know, Dashrath and Bhagwan Ram himself had gone through depression, then what is it? So it's kind of acknowledging that, you know, every being is vulnerable to those things. And the other challenge is quite often, I mean, for particularly older South Asian individuals, is the difference between dementia and normal aging. So how do we sort of educate the community that there is something called normal aging, but dementia is something different. And these are the things that we need to do. And so challenge really is that working at all levels, creating information in languages people understand and the words people can understand, and trying to use that as illustrating that this is, you know, common, this is in a kind of non-stigmatizing way, that, you know, it doesn't mean that everybody in the family is going to have it. It doesn't mean that you know, that there are kind of biological factors. There may be, there may not be, but it's also co-associated with physical health. And I think one of the big tragedies, certainly in Western psychiatry, has been that we've kind of separated physical and mental health. Whereas Ayurveda uses combination, you know, you kind of mind affects body affects mind, and these are affected by external circumstances, environment, pressures, stresses, etc. So I think we need to sort of bring that integration back in if we are going to truly destigmatize mental illnesses.
Yeah, Rakhee, what I wanted to add here is that everybody, without exception, sometimes go through, maybe temporarily, with mental health issues, may be bereavement, for example, and temporarily our mind and our actions and reactions don't coordinate coherently. So on the spectrum, we could actually experience that imbalance of not being operative in normal way. But the other thing I would like to bring in, just to say how we think about physical health. There are gyms, there are obsession about dieting. People go to gym. There's gym on every corner. But we don't actually look at mental health and mental fitness for everybody in the same way. We need to be mentally fit. And that means we need to look at our own baggage, on our access beliefs, and how to think differently. So looking at mental fitness and mental health in a positive way, to be fit in doing, enjoying, and being part of the system in a well and fitness way. Yeah, thank you.
So much, Pushpinder, and thank you also, Professor Bhugra, for your sort of super interesting insights here. Turning now to the next question that we've had in, and this is for Aanika and also the wider group as well, and it's on the sort of the topic of mental health, in that, you know, there's lots of encouragement about sort of or talk of mental health when someone actually has a problem, or if they're suffering with mental health illness, rather than encouraging mental health being more generally and its importance from a young age. So Aanika, the question that's come in is that schools seem to be bringing in more mental health and well-being into the sort of formal school curriculum. But is there anything that folks can do sort of early on and from home with their sort of wider families and children to sort of help promote sort of good mental health well-being?
That's a brilliant question, and actually, I was going to sort of add to what Pushpinder just said about the mental well-being and the physical and emotional mental well-being going hand in hand. So I'm actually at the moment part of the mental health team. I'm being trained to be a level 1 yoga practitioner, so we'll see how that goes. I'm on my 2nd session at the moment, so they're trying to bring that into the PE curriculum. And a lot of it, the training is not just based on the yoga. So every lesson that we have, they're kind of really questioning us on how is the mind and the body linked, which is really interesting for myself as well. And I know there's a lot of yoga groups going out for the youngsters as well, for, you know, nursery school. There's people that we know that are running this sort of yoga bunnies, the young kind of yoga group as well. And I think it's more about awareness for adults as well, parents, family members, that they need to educate themselves for them to know the importance of how to instill that. I mean, as a teacher and, you know, coming from an education background, I think, yeah, in schools we are starting, it's going to be a long process, but we're starting to do that. And that was really encouraging, because I couldn't understand why I was put on that course until we sort of, you know, realized that there really are, especially with after, you know, post-COVID, and, you know, they're really trying to educate the young students and the young children to know the link between physical and mental health. I just finished running a 6-week session with the PE department with the emotional well-being, and we did hand in hand. So it was a topic that we picked, and it was half a session on, you know, hydration or sleep or exercise, and a bit of it was, okay, how is this related to physical well-being, and then how is this related to mental well-being? They go hand in hand. You can't be fit with you know, if one isn't. So I think just as families, family members, parents within the community and the household, educate yourself, be aware of it, learn how important it is, and then instill that in the younger children as well. As teachers, we're trying to do the same thing on the other hand as well.
Thank you so very much, Aanika. This is really fantastic work as well that you're doing on the ground, both in a school and in the sort of wider educational setting as well. And also it's nice to hear how each one of us as well can really help this land well, sort of from a home setting in partnership with schools as well. So that's fantastic. Thank you. Turning to another question now that we've had more generally on sort of mental health support. One of our audience members has asked that they volunteer at a mental health day unit, but there hasn't been any support due to the pandemic since March 2020. And they've said that that's what's been sort of, it's representative rather of what's been happening nationally. They've said that there's a massive need in the community for something like, you know, mental health day units or that kind of formal support network. And they've asked, how do we think this will be resolved, i.e. the lack of sort of provision for that kind of care, and what's needed to ensure that, and what is needed to ensure that mental health support doesn't become the next victim of COVID. So that's a really interesting question, and quite a powerful one as well, I think. And it also sort of touches on, you know, what gaps we think there are currently in the sort of support structures around mental health. And also it might be interesting to hear from Mrunal as well as to, you know, the gaps in support structures in India as well. But maybe firstly, if anyone wanted to talk about sort of, you know, the mental health support in the UK, and sort of, as I said, you know, the question that's come in around the sort of slowdown or the gaps, if anyone had any sort of insights on that.
I think there's absolutely right observation that because of lockdown and so on and so forth, so things which used to happen and things we used to take for granted have gone. So the peer support is not happening as it should. Mentoring and supervising isn't happening. So I think it is sort of creating those kind of networks. And particularly for mental health professionals, there used to be, on the wards, there used to be sort of rounds, not necessarily to discuss patients, but as kind of supportive rounds, what were called Schwartz rounds, or you know, the groups where people met together and discussed things in a supportive way. So you got informal support for yourself. But I think one way forward may be to create, you know, networks like this, that, you know, kind of, even if it's not every week, every 2 weeks, every 3 weeks, just getting together for an hour, sitting down with a cup of tea and just chatting. And, I've sort of in the last 3 weeks, this has been really horrible for me. What do I do? And has anybody else had the similar experience? And kind of learning from each other, because it's the little things which make a lot of difference. And as Mrunal was saying earlier, that, it's a kind of little change which you can take charge of, which can make a lot of difference. And those little steps can then get you to the top of the hill.
Thank you so very much, Professor Bhugra. And I think that's you just hit the nail on the head. It's those little steps that can take us to the top of the hill. And, something that can sort of seem insurmountable or just a huge challenge. If we just break it down into small bite-sized pieces, I think that, that's certainly palatable, and it's definitely a lot easier to manage and achievable as well. That's great. So I think we're sort of now drawing to a close with respect to our sort of Q&A session. I just wanted to sort of reach out to the panelists and Aanika as well, in case anyone had any sort of closing thoughts or anything to add.
I'd just like to say I think this is fantastic. This is exactly what's needed. We need to be more open, we need to be more honest, we need people from all walks of life to take part and see this, that it's not just an issue within a certain group of people and a certain age group, certain ethnicity or anything like that. It's just out there. And like, Pushpinder said, that it's everybody has mental health, and this is what we keep repeating in schools as well. It's just looking after it and acknowledging it. Good mental health, bad mental health, we all have it. So I think this is just fantastic. So thank you for having me here.
Thank you so much, Aanika.
I would also just add that it's a pandemic had to happen for us to kind of all come together. I think it's the strength is in humanity and how we all communities got together to work and support each other, and it really showed. And I think that's one of the really important parts, again, of mental well-being.
Moving forward, we need, especially from the festival perspective, we need to put something in place to have an opportunity, a platform like this to discuss, as Aanika also was saying, that it's not just one age group, but right across the board, discussing how to have good mental health, and be by sharing and talking and having a platform. But I want to take this opportunity also to talk about our festival, which will be coming. And Rakhee, maybe you could give out the details of wonderful things that might have an opportunity, events and opportunities to talk, not just about mental health, but have a platform to talk about fun things. Yeah.
Absolutely. Thank you so very much, Pushpinder. Great. It's been fantastic to have this time with you this afternoon and evening, I know, from Mrunal, but sadly we have lost her, unfortunately. Yeah, as I said, thank you so very much for joining. We've had some really thought-provoking and insightful discussions on the very important and sometimes difficult topic of mental health awareness. We sort of as an organisation, and I think it was one of the comments raised earlier, in that we aren't a mental health organisation per se, but we do feel that we have a sense of responsibility to sort of help each other in times of crisis, and sort of to help ourselves heal from what has been a very difficult situation. And so we really hope that this session has gone some way to sort of creating an uplifting, safe space for all of us to sort of exchange our ideas and our own sort of personal issues. We've highlighted some of the pressures and challenges faced by South Asian artists, and in particular sort of more creatively as well. We've identified support structures and sort of highlighted areas where there may be gaps. And we hope that this has also gone some way to encourage an open discussion amongst South Asian artists and South Asians really more generally within our communities, to inspire others as well to speak up about mental health, because we were saying again that mental health is everyone's business. And I think if we all sort of take on a little bit of that ourselves and and just be courageous to sort of open up a little bit to even those that we trust and that are sort of our nearest and dearest. I think we will go quite some way to sort of helping to sort of resolve some of the trickier issues on this topic. So I'm going to now draw our session to a close. So a very special thank you to all of our panelists and our special contributor, Aanika, today, without whom today would not have been possible. A special thanks also to the UCAF team, and in particular, Aman Dillon, who is hiding behind that logo there, who has done a fantastic job in sort of scheduling today and making it possible. We did want to add also that, of course, if anyone joining the webinar today has been impacted by any of the issues discussed, then please do call our Talking Therapy hotline. That is a hotline that is available anonymously. Details are available on our website. It's brand new and shiny, which is tonguesonfire.com. So please do feel free to call in there. And as Pushpinder said, we're really delighted, of course, to announce our festival dates, which are behind me. I've been hiding them. 26th of May to the 6th of June. So stay tuned for that. We are so excited to be landing our program, which will be sort of announced on our social media pages and our website as well. We've got some fantastic content and events lined up. We are delighted that we are able to sort of curate some fantastic content for all of you. And we're delighted that we were able to do this, particularly on the back of, as we've just said, quite a challenging year. The theme is Ray of Hope, which is quite fitting, I think, given the discussion that we've just had. So yeah, as we said, we really look forward to all of you joining us for those events as well. So please stay tuned for that. And yes, as I said, thank you all again for joining, and it's been fantastic to have you all with us. And I hope you have a great afternoon and rest of the weekend.
Thank you.
Thank you very much, Pushpinder. Thank you very much, UK Asian Film Festival, for this wonderful, wonderful initiative. I mean, the Talking Therapy is fantastic. It's such a great initiative. And thank you so much for inviting me as well to speak for today. And I really genuinely enjoyed this discussion. I think it's so important to have this. So thank you so much.
Thank you.
Thank you.
Thank you.
Thank you very much.
It's been really insightful. I've really taken away so much.